Have you ever heard of direct primary care or DPC? It's a buzzword that maybe you have heard. It's becoming much more popular. And the good news is that I think it's finally finding its place as a commonplace, specifically in employer-sponsored health plans. No longer are the days where DPC is a buzzword, but it's a true strategy that you can use in your health plan. In today's episode of the podcast, we're going to dive a little bit deeper into what DPC is, how it's good for clinicians, how it's good for your employees, and why you might want to consider it at this renewal time. I'm Nick Lees, founder of NextGen Benefit Solutions, and we're on a mission to help 5,000 people achieve access to high quality, affordable health care in the next 12 months, and DPC is a huge piece of that goal. So what is DPC? DPC at the end of the day is direct primary care. Now, primary care that a lot of people are familiar with is that of kind of an institutional setting to where you pay a fee for a service, you go see a doctor. Typically they have a window in which they can see you. Maybe it's 15 minutes, maybe it's 20 minutes, maybe in a rare occasion it's 30 or more. But oftentimes they're short windows of time that you get to be in front of a healthcare practitioner to address your ongoing concerns, maybe your current concerns, and to evaluate your overall health. Now, this is something that a lot of people don't use on a really consistent basis, and there's a couple of reasons for it. One reason is just the access issue. Oftentimes when we're talking about in a large institutional setting, it can take weeks, if not months, to get into a primary care physician. And this is oftentimes frustrating for the consumer. They don't feel good today. They don't want to wait 6 weeks to actually figure out what's wrong with them. And a lot of times, maybe the symptoms start to subside, so they kind of just grit through it, which oftentimes doesn't leave anybody in a better position. It oftentimes leaves the patient with an underlying condition that really needs to be treated, but isn't, often causing larger problems that are more impactful to their long-term health. But when we talk about health plans, it has a massive effect too. Oftentimes these little ailments that need to be treated that go untreated wind up being much more costly endeavors later down the road. Now, the other side is that the fee-for-service model means that these facilities have to do a large volume in order to make the money that they need to make to survive. And that's why they cut down the windows and really decrease the time that a patient has in front of a doctor doing what they do best, which is practicing medicine. So that's why I'm so bought into the DPC model and why it can play such a vital role in health plans. Now, some people ask, what really is DPC? And one of my favorite ways to explain it is to tell them to go watch an old Western movie. If you've ever watched an old Western movie, you know that DPC is alive and well. And what is it? It's when somebody gets sick, when they get hurt, when they have an injury, maybe even when they get shot by an arrow. The doctor comes to their home and treats them in the comfort and convenience of their home. And that's a lot of what DPC does. Now, while we don't necessarily have a model where they actually come to your home and treat you there, we operate with two different models. One is an employer on-site type model. And this is where the physician or the nurse practitioner is actually going to come to your place of business and utilize a dedicated space to actually see patients, your people. The other model is to where the provider might have an office in your town or nearby to where your employees can easily go and access them. Now, one of the nice things about this model is that we take a lot of unpredictability and we make things predictable. So from a health plan perspective, one of the things that's always variable is how much money we're actually going to spend on primary care. And that fluctuates. Some years we use a lot more and some years we use a lot less. But when we look at it as a trend over a number of years, maybe 5 or 10 years, we see that that number is pretty consistent. So if we know you're going to spend that money, why don't we just consistently spend that money to get a better advantage? So that's where we use a subscription type model in direct primary care, to where we take a little piece of your monthly premium and we actually go purchase that direct primary care membership for your employees and their dependents. And what does that unlock for them? That unlocks for them to be able to go get access when they need it. But it also does something for physicians. It makes it more feasible from an economic standpoint. The only way that a physician can survive in a fee-for-service model is to have an outsized amount of volume. It's a volume-based game. And that volume-based game is leaving a lot of providers disillusioned. It's leaving them frustrated. And that's why we really need to start looking stronger about how DPC can be a part of our health plan, not only for our employees and for our health plan's security, but for those practitioners that are working so hard for us. So let's dive into a little bit more of how direct primary care is actually really good for physicians. If you talk to a primary care provider that is operating in an institutional setting, a lot of times their patient roster is going to be 1,000, 1,500, maybe even 2,000 people. There's no way that that primary care physician can build an intimate relationship with each and every one of those people. And the thing about it is, half those people may not even come on a regular basis. And so they really don't have a chance to develop that relationship and develop that personal understanding of a person's unique health needs and some of the challenges that they're facing and how they can overcome them. And so it's not that the primary care physician is not doing a good job. They're doing an excellent job. It's just that the way that it's structured doesn't allow them to do their best work, which is to truly be in front of people and to really help them establish what they need to do to have great health, to live their healthiest self. So in the direct primary care model, we strip out the fee for service. And as I mentioned, we pay a subscription or a membership fee to the direct primary care physician. Now, the first big benefit for them is that this creates a monthly recurring revenue, which, as you know, being a business owner or business leader, monthly recurring revenues are about as great as they get. That consistent and reliable income or cash flow is vital for a business. And this allows us to be paying or prepaying sometimes for the primary care physician's expertise, for them to practice medicine. But this means that it's a sustainable model where they can make the money that they need to make to take care of their families too. But here's the real beauty of it, is that from an economy of scale, a primary care physician that's operating in a direct primary care setting can operate with significantly fewer patients on their roster. And what that means is that they can get to have a much more intimate relationship with each and every one of them, where they can spend as much time as they need to address the health concerns of your people, to help them live their healthiest selves. And this is really a renaissance for providers, because here's what I can tell you I have found from providers, is that not a single one of them went to medical school specifically to get into primary care or family practice to make a bunch of money. They went to medical school because they genuinely love people and they want to help people. And with the direct primary care setting, we're able to help them more sustainably deliver on what their mission truly is in life, which is to deliver a world-class healthcare experience to their patients. Now, when we're talking about their patients, that also means we're talking about your employees. Unfortunately, in the fee-for-service model, which I kind of highlighted already, a lot of times we see patients delaying care. And it largely comes down to two things. The number one thing is the frustration. As I mentioned, sometimes it can be weeks and weeks, if not months, before you can get into a primary care under a fee-for-service model. And it's simply because they have to see too many people in order to generate the revenue that's necessary to make the business go forward. However, when we step into the direct primary care model, a lot of models allow 3-day visits, and that's planned visits. They still have the ability to see people for their everyday aches and pains or sinus infections on a 24-hour basis, a lot of times. Many times it's even faster. One of the beauties of direct primary care is that we give your employees access to the doctor or a resource of the doctors 24/7, 365. So while though it may not be your exact direct primary care physician that's responding, we build out the assets to make sure that your employees can text or call the direct primary care setting 24/7, 365. Meaning that when they have a child that wakes up in the middle of the night with an ear infection, they can jump on a quick call with their provider team who will give them a script to go fill in the morning so that their baby can get to feeling better. It means that when one of your employees isn't feeling well, they can jump over to the DPC clinic over their lunch hour, get seen, get an antibiotic, and be back on the work floor that afternoon. At the end of the day, it gives way greater access to your employees. It allows them to truly address their healthcare needs when they need to be addressed. And it really allows them to be their healthiest selves because they can access whenever they need to without any financial barriers. And that's where the part 2 of why direct primary care is so valuable to your employees. I can't tell you how many times we have seen a medical condition not be addressed in a timely manner because of the fear of going to the doctor and spending money that they didn't have. A lot of times, a primary care physician engaging with a patient or your employee quicker means that we're going to offset a much larger claim down the road. And with the direct primary care model, what we do is we build in 100% of the cost in that monthly membership or subscription fee. So that means that your employee can go to the primary care physician as many times as they need with no cost out of pocket. Now, some people say, isn't that going to create some frequent flyers? Yeah, maybe a little bit. But at the end of the day, even the frequent flyers, it's good to be in front of a good direct primary care physician. And here's why. One is they might actually have an underlying condition. But two, it might actually give the primary care physician an opportunity to really help that person turn around their health. So at the end of the day, employees are one of the biggest benefactors of a direct primary care model. It really helps them to get the care that they need from both an access and a financial access standpoint that a lot of plans are missing these days. So let's start to dive into why it might be a really good idea for your health plan to consider direct primary care. Well, as I mentioned, when employees delay or avoid care, either because of access issues or cost, oftentimes that leads to much higher expenses inside your health plan. And those much higher expenses are what's driving the cost of your health insurance to go up year over year. And so direct primary care can play a vital role in helping us address those small problems much sooner before they become bigger, more costly problems in your health plan. Now, another really key benefit to a direct primary care is they can be a godsend when it comes to navigation. You've heard me talk over and over and over about how healthcare is not created equal, and the pricing definitely is not equal. We can show case study after case study where driving just a few miles can often save thousands of dollars on procedures and surgeries. But one of the things is that when I tell your employees, hey, you should go here because you're going to save a lot of money, or you're going to save the health plan a lot of money, or you tell them that, well, who are we? I'm just a health plan consultant. You're just an employer of a manufacturing concern or maybe a construction company. They don't want to listen to you. But when their doctor says, we'd recommend that you go here, and here's why, because from our medical expertise, this is where you're going to get the best care and the care that you truly need, we find that employees eat that up. They love that model. And that model is what creates the incentive for employees to go somewhere else. And that's where we can continue to incentivize them all along the path. One of the things that I recommend if you look at a direct primary care is to continue to incentivize employees to follow the directions of the direct primary care. Oftentimes that means they're going to be referring to a lower cost imaging center to where maybe we can pay cash prices, or we have a direct contract to save substantial money on the MRIs or CAT scans that your employees need. That might be working with a outpatient surgical center to do, minor surgeries or orthopedic repairs. And that's where, if your employee is willing to travel down the highway that we build for them, kind of the deluxe highway, where we've focused on delivering the highest value of healthcare, but the most cost-effective healthcare. When they jump on that highway, let's incentivize them. Let's give them a free gas card to get that service. And I mean literally and figuratively the gas card. But let's waive the cost out of pocket for the surgery. Again, you've heard me talk about this over and over again, that oftentimes we can save tens of thousands of dollars on orthopedic surgeries by just being willing to travel a little ways. And a direct primary care physician can really help us navigate your employees into the best, highest quality care, but also the most cost-effective care, which brings that long-term stability to your health plan. So I want to wrap up today's podcast with the fact that direct primary care has been around for a lot of years. It just went out of style for a number of them. And quite frankly, a lot of that comes down to a misalignment of incentives. And I had a practitioner actually tell me that a direct primary care model is the best way to realign the incentives inside of healthcare to where we are super focused on outcomes, not how much, not how many patients we can run through in a given day to generate revenue. And this is where the best results come. So while it may still be a little bit of a buzzword, DPC is taking a stronghold here in the United States and is taking a stronghold inside employer health plans. And if it's not something that you've considered before, I would strongly urge you to consider it this year, because it's going to deliver better for your employees. You're better going to support the physician community, but you're also going to better support your health plan. If you need to learn more about how DPC can work in your health plan and some of the strategic assets that we've built out to make it viable, give us a call. We'd love to have that conversation and show you how DPC can be exactly the prescription that your health plan needs this year. I hope you enjoyed this episode. Hope that you can continue to tune in each and every week to learn something new about how we're addressing the high cost of healthcare and delivering better benefits. Have a great day.